Global Forum panel discussion, Psychosocial Wellbeing at Work, Global Insights, Local Action. This session embodies the ILO's 2026 framework, which examines psychosocial factors across 3 levels: the job itself, how work is managed and organized, and the broader policies, practices, and procedures that govern work. This session will be moderated by Dr. Rafee Baharudin, Associate Professor of Community Health at University Putra, Malaysia. He's Chair of the IRIOSH International Advisory Council and a leader whose work spans risk assessment, industrial hygiene, and national OSH policy. We will hear insights from Indonesia, Brunei, Malaysia, Saudi Arabia, Germany, Nigeria, and South Korea, demonstrating how psychosocial risks are being addressed through work design, organizational culture, and regulatory innovation in diverse contexts. Please welcome our moderator and distinguished panel. It's all yours, Dr. Rafee. Yes.
Thank you very much, Brandy. Thank you again, IRIOSH, International Research Institute for the Occupational Safety and Health. And Assalamualaikum warahmatullahi ta'ala wabarakatuh, and very good morning, good afternoon, good evening to our distinguished speakers, colleagues, and participants joining us from across the globe. Now, my name is Mohd Rafee Baharudin. I'm going to be the moderator for this session. And before I begin, I would like to invite all the panelists that has been given the pre-recorded video for the audience to see prior our sessions. Yeah, so I would like to invite Muthia Ashifa. Can you just please open your mic and say something to the audience? Muthia Ashifa? Just to ensure that your mic is working.
All right. Hello, good evening or good morning, everybody. I'm Muthia Ashifa. I'm currently working at one of the mining and energy company in Indonesia as HSE System and Compliance Department Head, and I'm also elected as the Indonesian Industrial Hygiene Association President. So hope everybody have a good day today. Thank you.
Thank you very much. Sounds very clear. The next panelist would be Dr. Khadija Abdul-Mumin from Brunei. Can you please open your mic and say something to the audience? Unmute, please. Unmute, please. Okay.
Okay. Hello, everyone. I'm Dr. Khadija. I'm from Brunei, and I'm an academician in Institute of Health Sciences in University Brunei, Darussalam.
Thank you. Thank you, Dr. Khadija. And then our third panelist will be my best friend from the Department of Occupational Safety and Health, Engineer Dr. Halim Hasan from Malaysia. Can you please open your mic, say something?
Hello, good morning, good afternoon, good evening, everybody. My name is Halim from Negeri Sembilan. Okay.
Thank you very much, Dr. Halim. And our next panelist will be from Nigeria. I'm not sure what is his time right now. Dr. Odu Josia. Dr. Odu, are you there? Odu?
Hello?
Odu, are you there, Odu?
Yes, I'm here. This is Dr.
Okay,
Odu.
okay. Can you please say something to the audience?
Yeah, this is Dr. Odu from Josiah Odu Hashim from Nigeria.
Okay,
Lecturer
okay.
from
As long as we can hear you, I'm okay with
Thank
that.
you.
And then we have Mr. Lee Yu Yong from Korean Occupational Safety and Health, Korea. So we have 3 of them right there, I think, in the Zoom. Can you please just say something from Korea, from Kosha?
Hello, I'm Mr. Lee Gu-yong at Kosha in South Korea. Thanks for inviting me to this forum. Thank you.
Oh, thank you. Thank you, Korea, for joining us. This is a very great moment for us to share our experience and knowledge in psychosocial hazards. And we also have a panelist from Bangladesh, Dr. Masum. Dr. Masum, where are you, Dr. Masum? Yeah, so okay, this is Dr. Masum. Say something to the audience, Masum.
Hello, good day from Bangladesh, and thank you very much for engaging me in this global forum. I hope this network will continue to build the occupational health and safety culture in the globally. Thank you
Yeah,
again.
just okay, good, very good. Just for your information, Dr. Masum has experiences attached with the International Labour Organization representing Bangladesh workers. And last but not least, we have Dr. Lupa Noah from the University of Southern Queensland, Australia. Dr. Lupa, are you there? Dr. Lupa?
Can you unmute me? Yeah. Can you hear me now?
I can hear you, but I can't see your face. Can you open your? Yeah. Now we can see you. Say something to the audience.
Yeah, let me say good evening from Australia. It's past 11 p.m. on Thursday. My background is engineering and project management, and it's just a great honor to be part of this forum. Let's keep the flag flying. Psychosocial problems or risks are real. Silence is not the answer. Digital twin is a game changer. Let's fly the flag. Thanks.
Thank you very much. And we have another speaker from Saudi Arabia, our occupational health physicians, Dr. Muhammad Asif. I saw.
Thank you very much for inviting, and my pleasure to be part of this forum. My name is Dr. Muhammad Asif. I'm the medical director in refinery. My much of experience is in the oil and gas industry. So, and my very much passion is about the AI and digitalization integration into the OSH and the health and safety. So that's the behind is more automation is there, more confidence is there about the people and the compliance to the system. And the key thing about is the how good and quality system has been built around the subject. So that's my passion. I work around, keep on improving. So thank you very much for that.
Okay, Dr. Asif. Now, I believe that every participant registered has see the video that has been pre-loaded earlier, and now I would like to ask Madam Muthia Ashifa with her topic integrating psychosocial well-being into Indonesia's industrial hygiene framework. Now, what is the common barriers in implementing psychological health and safety in the Indonesian mining operation? Perhaps you can share some of your insights, please. Unmute, please. Unmute. Okay.
Yes. Test 1, 2, 3. Can you hear me now, Dr. Rafee?
Yeah, I can hear you.
Okay, thank you. Because I think the host unmute everybody, so need some permission to do that. Okay. Thanks for your question, Dr. Rafee. I think the common challenges or the biggest challenge in mining industry in implementing the psychological health and safety in Indonesian mining specifically, we present or with some several challenges in our work sites, specifically if we are spreading out not just in a certain area, but because we are very spread out islands around Indonesia, and there's so many mining industry and companies throughout Indonesia, not just in specific island. So within those islands and within those regional area, the cultural stigma around mental health can be sometimes discourage open discussion. And sometimes the challenge is that when people being so closeted and not being such open to have those discussion, and then the solution for them to help seeking further management or further improvement might become a burden. And also the second one is about the hierarchical structures may limit upward communication. It also reducing some hazard reporting because some of in this industry, there's a certain called safety accountability program, which everybody's responsible to ensure the safety for themselves and everybody around them. And then one of the program is through the reporting of the hazards of any kind of hazard, not just the biological, chemical, physical, or ergonomical hazards that is surrounding the traditional context of health and safety. But also it is related to whether they are being, is there any opportunity or any chances that they are being harassed, or is there any kind of a bullying on site, or is there any kind of a non-inclusive clause or policy that's being implemented in their job sets, even though it is being monitored or being managed in the corporate function. So I think that's also one of the biggest challenges for us. And another thing is
how do you overcome the challenges then?
Yeah, we can overcome the challenges is by integrating the psychological health and safety into the existing OSH, occupational safety and health risk management system, and it's both in practical and also that is being efficiently implemented in the job sites. Indonesian Mining Organization also already applied structured process such as the HIRIDC, the Hazard Identification and Risk Management Program, some more detailed approaches with the both high risk analysis or with the critical control management program. So the psychological exposure or psychosocial hazard will be categorized as the material unwanted events. So it's be treated as the unwanted events similar like the one incidents or any kind of occupational illnesses on sites. And the same process can be expanded into include the psychosocial hazard without creating parallel system. The hazard identification should consider also factors such as workload, fatigue, supervision quality, and communication effectiveness. Risk assessment also should evaluate the frequency, duration, and severity of exposure to these hazards. This concept, the macro concept, is based on the risk assessment itself. And it's also should prioritize the higher order measures such as work design, not just based on the implementation person to person, but also the working environment and the work design, the staffing levels, the scheduling and leadership practice, which is very crucial in the mining industry, such as in Indonesia, because we still have so many people working on site, not yet transitioning into the AI or any kind of hybrid tools or equipments that are being used now. So rather than relying solely on individual coping strategies, we also try to make an approach based on the working environments itself. And the incident investigation should also systematically examine human and organizational factors alongside the technical issues. So in conclusion, I think by integrating the psychological health and safety into existing systems, the organizations can improve the quality of risk intelligence and strengthen the preventive controls. And then I believe also that executives plays a critical role by ensuring this integration is clearly mandated, resourced, and also monitored through governance and performance reporting.
Thank you very much. Thank you very much. What an extensive explanation. Yeah. And for the audience, whoever wanted to ask questions, you may open your mic and say questions or put your questions in the chat column. Yeah. And we move to our next panelist from Brunei, Dr. Khatijah Abdul-Mumin. As we know that you have been doing substantial research on psychosocial risk in healthcare. So could you share perhaps findings that can be translated into policies for reductions of psychosocial risk in healthcare, especially in Brunei, for example?
Okay, thank you so much, Prof. Rafee. I think in healthcare setting, we have a universal similar problem, similar issues. So most of the research that I've conducted was on nurses and midwives. And we also do during the COVID-19 research during the COVID-19. So there are many things that we could learn from the findings, because findings are still findings. And when we publish, it is publishable things. But what can we do from whatever we found is most important. So I think one of the things that we found is transparency. In any organization in the healthcare system, most of the participants in our studies, the problem is with transparency, like, transparency in terms of communication, in terms of what are the things that needs to be done from top to the bottom. And usually when this is not transparent, it caused chaos in an organization. For example, during the COVID-19, I think it's added more by every day we have daily, in worldwide we have daily changes in our protocols, in our rules and regulations. Another thing is adequate staffing and workload management. I think not only in healthcare system, I think in many organizations worldwide, this is a major issues. Okay, major issues anywhere in the world that we have low or insufficient staffing, and the workload management is very high in terms of sometimes you work beyond whatever you are supposed to do. Yeah, so in Brunei we have many four hospitals, and we are doing a lot of centralization. We refer large or major cases in the bigger hospital. So the thing about that is sometimes the workload management is not similar from one hospital to another hospital. Those bigger hospitals sometimes they have doctors around who can help them with solving healthcare provision, but those who are in the remote areas, like in the remote district like Temburong and also Tutong, I think similar to in other countries, because we have smaller hospital in the remote areas, so they do a lot of things which sometimes covering the doctor's job. So it's more on midwifery and also nursing led in for the healthcare workers. Aside from that, we can also sometimes it's just not. The thing is, sometimes when we start working in the healthcare system, our boss will say to us, "Come on lah, be more resilient." Those kind of thing. Like, oh, you just join and then you are like this, you are weak, kind of thing. So there are some stigmatization and also discrimination around that thing. Like, if we don't show that we are strong, then that's mean we are weak. Or are we providing a means of or a mechanism by which the workers are able to express whatever is pressuring them, their mental health? Are we taking care of their mental health? So I think these are some I got lots, but I mean, I'm just gonna give ways for the other speakers to to contribute, but I'll come back when we have questions again. But that are some of the the solutions that we can have, like staffing, workload management, compassionate leadership, anti-bullying, hopefully, and all the resource management thingy. But I'll come back later on. We'll give ways to the others first.
Yeah, so we hope audience can also ask questions to you. Yeah. So while waiting for that, before I proceed with the next panelist, I would like to call upon Professor Vincent from the OSH. Are you in? Professor Vincent, please say something.
Hello, how are you? Can you hear me now?
Yeah, I can hear you, Angel. Thank you for joining us. Thank you for joining us. And we hope to hear from you as well. So do you have anything to say about the psychosocial risk based on your experience leading the OSH?
Yes. Well, actually, yes and no. Well, first of all, thank you for inviting me. I'm the Secretary General of APOSO, the Asia Pacific Occupational Safety and Health Organization. And I've been doing research and practical work for the last 40 years. And I truly appreciate all the efforts that you have been doing and all the speakers. But there's always one thing in my mind that we as OSH practitioners are lacking of, is the power of change. Every time when we come a proposal, go to our boss, our CEO, half of them get turned away, get turned down. It's somehow we need to find a way to educate a businessman that this is the future of the profit. If they don't change this psychological safety and health well-being stuff, they are not going to be productive forever. if you look around, the businesses are run by CEOs, finance guys, from MBAs, and very rarely they come from the safety field. And we have one in Hong Kong as the CEO and chairman of the board now with a major corporation and came up from the safety field. But as I see his career also slightly changed the profit behavior and thinking. So we have to find a way to communicate with them that safety has to be equate to, I hate to be materialistic, to be dollar sign, and they must put this into the agenda. All board meeting, if you look around, all major corporation board meeting, nothing about safety. I work as a consultant. I try to persuade several board directors that throughout your monthly board meetings, at least save 1 month, one topic to talk about safety. Before my retirement from a major corporation, I make them to reserve one of the meetings in August, give me half an hour to tell them what safety is about. And then they ask for more. So somewhere, somehow, we need to penetrate into this leadership level. And otherwise, we've been just talking to ourselves, and we know we're doing good things, but somehow we're not pushing it. Without the finance support and resources, it's extremely difficult for us to be substantiate ourselves and for us to push whatever our policy risk assessment onto the ground in a sustainable way. So sorry, I'm not trying to be negative about it, but I just have gone through the exact experience last week when I tried to push into a major corporation board of directors to add safety into the agenda item. What do you
Prof,
think?
thank you very much. Thank you very much for your sharing. We really appreciate that. You know, it's very difficult to change is everybody problem around the world. Thank you very much, Prof. Vincent. I think we have questions from the floor. Perhaps we can call upon Oluran Femi, Jonathan. So can you please open your mic and ask questions to the panelists? Oluran Femi. Are you there? Mr. Olu, are you there? Yeah,
Nigeria.
please say something. Nigeria, okay.
Yes, I'm here, sir. Good afternoon. Thank you so much, sir. And congratulations once again for the IRIOSH Global's question. My question is this, sir. I have a member suddenly become withdrawn, absent from work frequently, and perform poorly. As a co-worker, how can I support the kind of employee, a co-workers with me?
Come again. I can't hear you. Can't hear you correctly. Come again.
Do you want me to I heard him clearly. He said a staff member suddenly becomes withdrawn, absent from work frequently, and performs poorly. As a coworker, how can I support the employee?
Oh, okay. I think the best person to answer this is Dr. Masum, because we are working with the ILO. Yeah. So perhaps you can say something about how co-workers, can cope with these matters. Please, Dr. Masum.
Yes, thank you. This is really a question. It's from the factory level, I think. This is a very interesting question. My understanding is that in that case, organizations, especially industry or the factories, should develop some system within the organization to overcome these difficulties. Within the industry or factories, I think safety committee is there. Then safety committee play a pivotal role to minimize this gap between the workers and the peers. They can play an acting role. At the same time, from the industry management level, they can share some ideas and thoughts how these gaps can be minimized within the factory level through from the psychosocial issues. At the same time, from the legal perspective also. What are the things are available within the country? That's need to be systematically provide support. If Bangladesh in Bangladesh there is no psychosocial support or this kind of facility is absent totally in our factory or industry level. I think in future Bangladesh can think also different countries if they have no organizational or industry level system within their workplaces, they need to think how to overcome this situation. I think this is really a common phenomena within the workplaces where we need to think and we need to work. And thank you for asking or raise this question in the global forum that we can think in future to work together how to overcome the situation. Thank you.
Thank you, Dr. Masum. I think hopefully the answer benefits Mr. Oluranfani, from Nigeria. Let's move on to Dr. Lupa. Dr. Lupa Noah. Am I pronouncing your name correctly, Dr. Lupa?
That's all good.
That's all good, right? Now, you are talking about the psychosocial impact of digital adoption in health and safety, right? And then the role of regulation and compliance. So could you explain about how the artificial intelligence enabled safety reporting system will impact mental health in the SMEs, please?
Psychosocial issues are somewhat in it. They are not easily discoverable. So, in the workplace, especially in the construction industry, self-denial is one big issue with this aspect of the workplace. The other issue is organizations, construction organizations, for example, they don't even consider it as a problem. So even where it's considered as a problem, the finance people don't even have any budget for it. So technology comes in here to play a big role. If we can simulate our workplace processes, for example, digital twin can be able to help us to predict and simulate risk, psychosocial risk that could harm workers and impact their performance. So, if I answer your question correctly, it's self-denial, lack of attention to it. It doesn't matter. It's always the attitude towards it. So first of all, to solve this problem, the policies in Australia are attempting to address psychosocial problems because it's a big killer of the workforce. Although it's not being pushed very hard as expected, but policymakers are beginning to pay attention to it. So, the more we talk about it, the more it will sound a reasonable bell to the authorities, and from the research point of view, as we demonstrate to them, as we show them these frameworks that technology can integrate the processes that we already have in place, we can improve on them using technology to get psychosocial issues identified proactively and treated before they even occur.
Okay, Dr. Lupa, thank you very much for your answers. And I believe AI could do two things, good things and bad things.
Yeah.
Yeah. And we also have a questions from the floor. Perhaps you can look into it, talking about the AI. Yeah. And may now I go to Engineer Dr. Halim Hasan, yeah, from Malaysia. He is talking about the guidelines to enforcement from the perspective of Malaysian Department of Occupational Safety and Health in advancing psychosocial safety at work. So, what is the government's long-term strategic vision regarding mental health at work under the Occupational Safety and Health Master Plan 2026 to 2030? In short, we call it OSH MP30. Please, Dr. Halim.
Yeah, thank you, Dr. Rafee. For this, what I call OSH Master Plan, this is for 5 years we call plan under this OSH roadmap. This is for pioneering the psychosocial health assessment in Malaysia workplace. Is designated as a main core business. So this master plan is aimed to number one is to establish we call that one OSH or one KKP as a seamless one-stop hub for the all OSH implementation. Second one is to drive a massive surge in the nationwide for the OSH compliance by another 5 years from now is 2030 and cultivate an employee-driven OSH transformation. And the last one is to ensure inclusive and equitable protection so that no segment of the workforce is left behind. I think that's all this our plan. Thank you, Dr. Rafee.
Okay, thank you very much. Because I think Malaysian we have a very good strategic plan in managing psychosocial hazard at workplace by having our Prisma, framework, and we go to Kosha. We go to Kosha now. Mr. Lee, based on your presentation, you are talking about integrating mental health into OSH management system, right? And what are the challenges faced by the OSH practitioners in integrating mental health initiative into the Korean workplace?
Okay, I think there are three challenges. The first is the limitation of organizational and cultural awareness about mental health problems. Many workplaces tend to view problems such as depression, anxiety, and burnout as individual vulnerability. So it's difficult to access them because there are many workers who feel burdened by counseling or psychological support itself. The second is the limitation of expertise of health manager. In South Korea, health managers are mostly nurse or industrial hygienists with a shortage of trained and experienced in the mental health field. So the workplace may use external mental health institution to support rather than direct management. But small workplaces lack this linkage system. Third is the difficulty of measuring performance. Mental health projects are difficult to confirm the effectiveness with immediate figures like accident prevention project. So it has limitation in securing budget or promoting projects in the mental health sector due to difficulty in verifying the effectiveness of investment. Thank you.
Thank you, Mr. Mr. Lee Kuyong. Thank you very much for your answers. And then Dr. Asif, can I ask you a question now?
Yep.
Yeah, okay. I got two questions for you. The first one is about the mental health in AI-driven work environment. And can you just say something about the reporting system that will impact mental health?
what I believe that for the AI-enabled system, they empower people to have like a standardized and reproducible reports, and that's all quite auditable. They have a chain of trains where the people can follow them up. They can link with the standard. They can authenticate it. So any report that is AI driven has a consistent reproducible factor, and that's a great asset in reducing the stress over the people. Because if you see from audit perspective, for example, many times the people don't expect the auditor how they will come and what they will come up. But when our systems is generated through the AI based, it always give like a very clear standardized where the employee and reviewer both knows where we are coming from and what we have to look for that. And the compliance perspective set a very standard practice on that. So what I want to say is that any system that is now AI built, it is keep on updating itself, it is standardized, and the response is anticipated and inspected. So that there is no stress of the people that they have to think about it, complied, not complied, what we miss, what we don't miss. And you know, in industries, many times people start hiding behind something to avoid this fear. And that fear led to sometimes mistakes. They try to hide things. So now the process is going on that if you put into the AI into your processes, and what I present is like safety system, it will help any remote, simple worker to set up a system that can help him credible compliance to the safety standard. That's I can see, and that is very much producible, and we can work on that.
Dr. Asif, the other questions that I would like to ask you is based on audience questions in the chat room. According to him, AI makes work move faster, which puts more pressure on employees and causes burnout. So, can you recommend how leaders can use AI to help workers unplug and truly disconnect from their jobs? Could you please comment on this?
Okay. What I understand is that someone has asked about AI work faster, and it puts people like under pressure of being out of the job or out of the pace, right?
It causes burnout.
This is the question?
Yeah, this is the question. So how could leaders do something about this?
Okay. Now, we should think about AI as an enabler tool. And think about ourselves when we were using the Excel, and people who were expert in Excel 10 years back, they were outpacing the people who were doing the manual work. And the same AI is doing with the people who are using Excel now, and they're outpacing the people who are still using the Excel. What I want to say is AI is a tool. It is make us learning the new way of doing the things, and we have to focus our energy towards the things that is beyond the AI capacity, and this is beyond the AI scope from there. And that's how the innovation is quickly very coming. I think about 8 months back something, now it's redundant, and this is the reality of the AI. Managing that associated stress is only thing is that we have to equip with the new skills, keep up pace with the AI developments, because no way we can avoid AI. My company recently, they just introduced the in-house internal AI medium where all the documents and everything is over there. Now we can think of that we can write over there, and some finance question will be answered without a finance guy to me right in my screen. So we have to accept this. We have to upscale our skills. We have to learn new way of engaging into the business, and we should be ready to transform it. You know, transform means we may out of one business, but we should be able to transform into another business or another work profile. This is fact of life, but the only thing I recommend is to be ready, equip yourself, and make yourself keep on learning on that. And we are all doing it.
Thank you, Dr. Asif, for your extensive explanations. Dr. Lupa, are you still there? Dr.
Yes, I'm
Lupa?
still here. I'm still
Yeah,
here.
now coming back to you, since
Yep.
you are doing some psychosocial impact of digital twin adoption, right? So could
Yes.
you tell us, does anyone have practical experience on applied digital twin on a project? And what are the challenges then?
Yeah, digital twin is still in its nascent stage when it comes to wide scale implementation at the industrial level. Some organizations are using it, they've started using it, but the construction industry in Australia is very, very traditional, very laid back when it comes to digital transformation to tackle the various issues that the industry is experiencing. Um, People are strongly averse to change, and they just want to stick to what they know because of they want to play safe. The focus is more on the bottom line of the company. So uh, generally, digital technologies are not prominently being applied in the industry. Some government agencies in Australia, like Defence, they are applying digital twin in a few cases, but again, its wide usage is very, very limited. Now, part of the problem these organizations, especially the construction industry, they give is finance, lack of incentives, and all that. So it's still being talked about a lot, but the wide implementation is still at the nascent stage. The other problems that or challenges that organizations are faced or are being faced with a digital twin is a lack of policies to enforce its usage in organizations. Also, people are generally scared of um, data maturity. Um, Privacy issues come into um, limelight when conversations around this technology is brought up. So practical implementation is very limited, and these challenges are real. But the research community in Australia is pushing it. Studies, research work, which I'm part of it, um, is really focusing on this change so that it can be widely used in the nearest future. So that's what I can say for now. There is one practical example in Sydney. There is a massive train station that has been recently redeveloped in Sydney, and digital twin was used as a tool to enhance the quality of this project. Although in terms of psychosocial risk, there was no much mention or focus on it. But as I said earlier, there are so many questions being asked by people who are averse to change. So hopefully, we're hoping that very soon this technology will, these challenges will be overcome and people will just go onto it.
Thank you, Dr. Lupa. So we are actually running out of time, and I saw a couple of questions coming out in the chat room, and we are going to answer these questions, yeah, and provide the feedbacks in our website. So I would like to call, each and every panelist to give very powerful key messages to the audience. Perhaps I can start with Ms. Muthia Ashifa. One powerful key messages to our audience, please. Unmute, please. Unmute.
You're still me. Oh, there you go. You're good.
Okay, all right. Thank you. So sorry for that. Right. My one final statement, I think it would be psychological health and safety is not an optional. It is essential for safe, resilient, and sustainable operation, not just in the mining industry, but I think it's through all of the workplace. So that's it for me. Thank you so much, everybody, for this opportunity and time to have a discussion with all of you. Thank you so much.
Very good. Short, sweet, and sharp. Okay, Dr. Masum, your powerful key messages to the audience, please. Dr. Masum, unmute, please. Okay.
Okay, just one simple message from my side, like is act locally to build a culture to promote psychosocial or mental health stress, getting from global experience to reintegrate the global experience at the national level to improve the situation of mental health and well-being. Thank you.
Thank you, Dr. Masum. Let's move on to Dr. Khadiza.
Hello. Yeah. I think for me, related to the our presentation today, healthcare workers have been taking care of other workers, and I mean the whole population, working population, who have problem. But the question is, who will take care of the healthcare workers? Thank you.
Thank you. So who is going to take care of healthcare workers? Okay, let's move on to Dr. Lupa. One powerful key messages from you, please. Unmute, please. Unmute.
Yeah. The digital twin technology as an industrial for technology is a real platform, a tool that can change the whole scenario around psychosocial risk, not just in the construction industry, but other industries as well. So the next step is to pick up case studies and validate the framework around this.
Thank you,
Thanks.
Dr. Lupa. Thank you, Dr. Lupa. So can we go to Dr. Halim? Powerful key messages to our audience, please.
Thank you. For myself, I think the best thing is everything you want to do is you must have a plan. So like our site, we already have this OSH master plan for 5 years for the long-term planning. It means to achieve any activity, I think must be well planning to whatever program we are set should have the objective and then to capable to achieve all these objective towards the end of our plan. Thank you.
Thank you, Dr. Halim. Thank you, Dr. Halim. Let us go to Kosha. So any powerful messages from Kosha, please, Mr. Lee?
The mental health of workers requires active intervention and support from the government, just like the Occupational Trauma Counseling Center in South Korea. Thank you.
Okay, very good. So in short, whatever we do to prevent this psychosocial hazard from being so far, we need to also have, asking or seeking help from the government itself. Dr. Asif, are you still there, Dr. Asif?
Yes, I'm there. So
Yeah,
my
yeah, please.
one message is embrace the technology, go along with AI, but still keep learning your physical skills on hand. So all these things go hand by hand, and also the kindness and consideration of the it should be revolve around the human being. I mean, we should use AI as a tool to make job easier, facilitator, simpler for the people to more enabler rather than extinguisher from the services. That's my message out of it.
Okay, send my regards to your son.
Yeah, yeah.
Okay.
I'm sorry.
Okay, Dr. Odu, are you still there, Dr. Odu? Dr. Odu, are you still there? You have the internet problem just now. Are you still there? No? No. So I think thank you very much to all the panelists for providing good suggestions, good recommendation, powerful key messages to all of our audience. And I believe your thoughts and thinking towards, making the psychosocial risk going down, and whatever we can do together of government in reducing psychosocial risk at the workplace. So with that, thank you very much to all panelists.